Welcome to Mexico, and it's my pure pleasure to be interviewing the chairman of the Department of Psychiatry at UC San Diego Health Sciences. The person I'm speaking to is Dr. Jeffrey Daskalakis, and I first met him in Toronto at KMH. And now, somehow, we've been able to meet in Mexico, and we're going to talk about all things depression. Well, Jeff, thank you for making time during our Mexico little visit to a mutual place.
My
to have
pleasure.
a conversation. You know, I've been admiring your work from afar before I met you, because one of my patients was a patient at KMH. She had a refractive type of depression. I know you're a psychiatrist. Some people think that a psychiatrist is the same as a psychologist. Tell them the difference between the two.
So the major difference is the psychiatrist is trained through medical school, finishes typically 4 years of medical school, then does an additional 5 years of residency training in Canada.
How do you define depression? Because for me as a family doctor, we have a checklist of depression. You have a mood disorder, you can't eat really well, you have no energy, you feel sad, you want to withdraw from people, and when it gets more serious, you feel suicidal. Now, I think my patient had all of those, and she tried all kinds of antidepressants throughout her entire life. And then she came upon your research project, which was all about magnetic therapy. So it's called TMS. Can you expand upon it? Because we're very lucky, by the way, that Jeffrey has advanced this area of TMS, and he's now a global expert, and I thank you for that. And I know it works. So what is TMS?
The TMS stands for Transcranial Magnetic Stimulation. In fact, what it does is it corrects the wiring of the brain and recreates the brain's wiring pattern in healthy ways, which is ultimately what treats depression.
Is that what people call making the brain more elastic?
That's exactly it.
Okay, because that's a sexy word people talk about.
That's
now.
right. We call it neuroplasticity.
Why does it work?
To begin with, about a third of patients treated with depression. That number is large. I mean, if you think about it in terms of the entire population, it's about 2.5% of the population. So in a city of 1 million people, you would expect somewhere around 25,000 to be affected by a resistant depression, a depression that does not respond to treatments. And you nicely describe what it's like, the experience of having depression. It involves being sad, but it can also involve not being able to derive or extract pleasure from doing things that are typically generate a lot of emotion, a lot of positive feelings. And so this treatment is used specifically for that 1/3 of the population that does not respond to medications. And it works through an entirely different mechanism. So we typically think of depression that is responsive to medications as being a serotonergic responsive depression, or a noradrenergic responsive depression that is in response to those particular neurochemicals. But with TMS, we're thinking about a different type of depression, potentially a depression that responds to a rewiring of the brain, or a neuroplasticity.
So it's an electricity problem as opposed to a chemistry problem, maybe.
That's correct. Although what we now are increasingly understanding is that there's no distinct difference between the two, that all of these systems converge on one another.
Nothing's ever so simple,
That's right.
It's not either or. I guess in a house, you can't just have plumbing and no electricity.
That's right.
Makes sense?
That's right. But what it does do is it corrects the asymmetry in our communities, which is an imbalance between those responding and not responding. We are offered more options.
And so for all the people who think about magnets and putting a helmet on, I don't even know how you do it. It's no longer a helmet now, right? And we're wondering, is it safe? Like you're messing with my brain. Like, is it safe?
It's actually perfectly safe. It is associated with virtually no side effects. And certainly we know with medications are associated with considerable side effects. Headaches, they upset your stomach, they can cause weight gain, put you at risk for diabetes, they can cause sedation. Those are all side effects that people are willing to endure to be effectively treated. TMS is incredibly safe. The worst side effect of TMS is a transient headache.
Yes, I recall she saying that.
But apart from that...
But it's not very bad. It just feels like your brain's been worked over almost.
Correct. And
Okay.
we think it's related to the fact that we're stimulating some of the muscles in the scalp
That's it.
that replicates a tension type of headache.
Okay.
But other than that, there's a real remote risk of developing a seizure, but that risk has actually been shown to be on par with the risk of developing seizures with antidepressants, which is
Wow.
exceedingly low. So when used the right way, TMS is extremely safe.
So how long do you just sit with the magnet? Every day? I think it's for a good several weeks. So what's the first treatment course?
The treatments used to last about an hour a day.
Mm-hmm.
Now we've managed to advance so that our treatments are now only a few minutes a day.
Okay.
And it can last upwards of 4 to 6 weeks. So the treatment itself is daily, 5 days a week for up to 6 weeks. But it's a very short treatment. In other words, you can be in and out in a relatively short period of time.
How many people around the world have used this now? It was really thrusted forward by you initially in Toronto, Canada. And so now you're at UC San Diego. How many patients have been treated with this around the world now?
I can confidently state that there have probably been millions of people around the world that have been effectively treated with TMS. And the numbers keep growing.
And that's exciting.
Very exciting. It's very exciting to be able to offer an alternative treatment to medications for people and to give them a sense of hope.